and hitting it. Well, we're live and welcome to the 7 o'clock talk. And tonight we're going to kind of go over why we do what we do and the way we do it. So we're going to let you in on how we do things and the thought process on why we do it that way, and start to show how Integrated Health of Indiana is a very well-rounded one-stop shop for just about any and all of your diseases, chronic diseases, and things like that. And so, first off, I mean, we've talked about them before, but one of the things that we do, and I'll show you on this, if we look at a treatment map, a lot of doctors and medical or functional medicine doctors, they don't follow a path or a program. So what they do is they start to go in and they look at random tests. And we really look at the foundational tests, because if we can get into the foundational tests and we can look at how stressed you are and how your gut and body are made up, and then look at like how what you're using, looking at your blood and your urine, we can see what happens and how your body is using the things that it's using. But we follow a very regimented program. And we start out and we work with the neuroendocrine system. And in the neuroendocrine system, we hit female hormones, which is her passion. And I will let her talk about the female hormones and what all that affects and why we actually.
You didn't tell me anything about this.
Well, it's not like you don't talk about it all day, every day. It's not a bad thing.
What do you want me to talk about?
Talk about why we address female hormones in the first phase of care.
Well, it causes issues with your thyroid, bone density, mental health, anxiety, depression, and lots of other things.
And so that's exactly why that fits into the first section, which is the neuroendocrine system. And we deal with the hormones there because if your hormones are off, your mitochondria will be off. And so this is part of the reason why we are going to do the master class at the end of February on mitochondrial health and energy. Basically, we're calling it the Get Your Mojo Back seminar. But those hormones, if you don't feel good.
I forgot some stuff.
Go ahead.
Joint pain.
Big time joint pain, especially for women.
Can't sleep.
No sex drive.
Yeah, no libido. Headaches. Skin problems. Hair falls out.
Well, and this is one of the first steps. When we start with the neuroendocrine system, you immediately start to address for most women, and I don't know why it's such an epidemic, especially in our area, but we see a ton of polycystic ovarian syndrome. And these poor women, well,
it's just bad diet.
Well, bad diet for a long period of time, high insulin, stress to the max. And so when we see these things happening, I mean, we get women almost every day coming in and they have polycystic ovarian syndrome, and they have facial hair, and they hurt, and they have hormonal headaches.
Yeah, you know, as soon as they walk in the door, they don't even have to tell you anymore. It's just very classic signs.
Yep. And for the guys, you know, if we don't have enough testosterone, guess what? We do not build muscle. We don't retain muscle. And we don't feel good. And we don't have the energy to do the things we want.
And all of this reflects on your relationship.
Mm-hmm. It definitely reflects on relationship. It reflects on your money. Because if you don't feel good, you're going to be spending lots of money on coffees and Monsters and all of these other things. And so that
just compounds the problems.
Yeah. And so that's where we're looking at the neuroendocrine system and we treat it first. And we do that by looking at the adrenal stress test. We look at cortisol awakening response and the hormones. And so that all falls into the adrenals, neurotransmitters, and energy. And because if you don't have energy, you don't feel like doing anything. And if you don't feel good, you don't. That's another thing that the neurotransmitters in this section, you have to get the neurotransmitters right, because if your serotonin's not right, you're not sleeping, healing, and repairing. If your dopamine's not right, then you're not getting that. When you do something, the reward hormone in us is dopamine. And so we can see what's happening there. And usually, if your adrenals are off, then you have problems with your gut, you have problems with your thyroid, and that just starts a whole nasty cascade. Once we start to treat that, and you GI treatment, sorry, neuroendocrine treatment first goes for 2 to 3 months, and depending on if you're a stage 3 adrenal fatigue, it can go 6 months to a year. It all just depends on where you are. That's we can't give you a time frame because we don't know where you're at, and that's one thing that we will kind of cover when we look at the February 28th energy seminar. We're going to do some questionnaires and look at what kind of stress you have. Do you have stress? Are you adrenally fatigued? What is it? So we'll go into that. Pay attention to the website, because our website, integratedhealthofindiana.com, will have a pop-up soon, and that pop-up will take you to the questionnaires, and you can bring those in with you, and we're going to go over them in the class. After the neuroendocrine system has been addressed, then we move into the GI system, and there's 4 components or parts to this. There are pathogens, there's food, there's the leaky gut, and the microbiome. We have to get in there and address those things, because guess what? If your gut's leaky, you have sinus issues, you have allergies, you have skin issues. There's all kinds of stuff that leads to. Her favorite segment, because there's really only 3 things that break a body down. One thing is stress, another thing is inflammation, and the last thing is food. And
I hate food.
food is not her friend. But that just plays to the underlying symptoms inside the gut. And she's getting better. She's getting where she can eat stuff. And we also are looking at probably like an alpha gal problem, which is making her very sensitive to red meat. And that is associated with Lyme. So we're dealing with a lot of chronic infections when we do this stuff. So once we look at the GI system and we start to treat it, we want to get rid of the pathogens. And we do a test that looks for the pathogens. It looks at how your digestive system is doing, how the pancreatic elastase is doing, how your hydrochloric acid is doing. And so we can get rid of, without using strong medications and killing the microbiome off, we can get rid of the pathogens and the things that are affecting you on the inside, because those things, they're like a drag on the body. So if you have an infection, is it going to kill you? No. But is it going to slow your body down and make you more susceptible to things? Yeah, it does. Yeah, Libby's knocking on the door. And so the GI symptoms, depending on how bad you're doing, if we have to go through a killing phase, that's a couple of months. If we have to just seal up the gut, that doesn't take long. That takes about a month, 4 to 6 weeks, if that. And then figuring out foods, we want people to be able to eat. You have to be able to eat because you have to exist. And food should not be something that makes you afraid. And she's getting to where she's eating more vegetables, and you're not sensitive to tomatoes anymore. You're not sensitive to the peppers anymore. So we're seeing signs that she's healing as she's going through these, and I'm going through these stages. And so after you heal up the GI system, The third phase, the final phase that we go through, is detox. And that's where we start to look at how's the liver functioning. And the reason why we do detox last is if you don't have these other systems working and hitting and able to eliminate, what happens if you start to detox? How do you feel if your liver's not moving things and you're not having bowel movements and you're not eating right?
Feels like you have the flu.
Feels like you have the
Yes.
flu.
You're sluggish. Your head hurts. You just feel like garbage.
You can have what is called a Herxheimer reaction, and that can be pretty severe. But these things are the things that happen, and we can look at how the liver is doing. Then we can look at detoxification and methylation. So when you take in your B vitamins, when you take in these things, are you able to put them through the system and put them into a usable form inside the system so that it helps you feel better? And then we do nutrient replacement, and we deal with inflammation all the time. And she actually does a great deal for the nutrient replacement because we do some nutraceuticals with that stuff, but that's only 30% absorbable. And what she has been noticing now with having people on IVs, especially the women, what have you been noticing, especially recently with the women?
Well, usually they come in and they aren't feeling well or they're tired and they want energy, so that's why they usually show up. And usually they look run down and tired. Usually after I see that, usually between the second and the third IV, they have beautiful skin. They're brighter. If they have high blood pressure, their blood pressure slowly starts coming down. Their nails grow. Their hair grows. They're not tired. They have energy. They don't need naps.
Well, the tongue starts to fill in, the scalloping on the side goes away, and more importantly,
That's your gig.
we have seen lots of women now. If you go back to some of our first videos, look at how white her hair was. She doesn't color it now, and her hair's coming back in dark. We have two other women that have been with us now for several months, and their hair is coming back in dark without color. Not adding any product to their hair. And so when the body is given the things that it needs, and you've taken care of the neuroendocrine system, the GI system, and you start to detox, these things come back. And gray hair actually goes away naturally. A lot of people say that it's a copper deficiency, but if your copper and your zinc is out of balance, then you've got to balance that out. And one of the best ways to balance that out is to make sure that the gut is doing well. So these are the reasons why we do the things we do and how we do the things we do. And we've actually transformed the entire clinic now to where it's
fabulous.
It's darker, it's soothing. There's a water feature. The lights we've gone away from the bright fluorescence.
In the treatment areas, the
where I adjust is still bright.
Yes, and then the entry room is dimmed with a water feature, and then all the other areas where they're meant to relax has rice paper lamps, no overhead lights, soothing music.
And so what we offer the community is we have a place where if you are micronutrient deficient, you can get IVs. If you're stressed, we have a Reiki master in the clinic now who does Reiki by appointment. We also do acupuncture. We have the ability to go sit in the massage chairs in a calming environment. We can put you into a cold, dark room if you need that. We can do breathing exercises. There's tons of ways to start to make the body calm down. And then to help bring in nutrition, we use top grade nutraceuticals.
She really wants in.
Yep. We do the IVs with Jess. And
And they're not all. We have several IVs, so you can come if you need if you're dehydrated and you need hydration. We can help you with that. We have IVs that are specifically for hair and nails. I have one that I just really love that helps us in a functional medicine sense. And all of them have micronutrients.
all of them have B's and
all
C.
of them have B's. It's just the level of each one, and then we add
glutathione.
we have glutathione and all the an amino mix added into them.
So basically, what the IV does is it's a multivitamin that is 100% absorbed in a bag, lasts 2 weeks to 3 weeks. You get glutathione, which is the body's own natural detoxicant. And when you don't have to make it, it allows your liver and your gut to do other things. So we release body burden by doing IVs and putting you on nutrition and getting rid of the standard American diet. If you're not willing to change your diet and change some lifestyle things, don't waste your time and our time. But if you're ready to actually implement change that will make you feel better, reverse your chronic diseases. We've seen diabetes reverse now in the clinic, I don't know how many times. And it's just a healthier way to live. So those are the IVs. Of course, we have chiropractic care, which for low back pain and neck pain, as long as, here's something. If you are a chiropractic patient and you get adjusted and you leave the office and you get your pain back within 2 to 3 hours or within a day or so, and it's regular like that, you are taking a chiropractic aspirin. You are not getting to the root cause of the inflammation, and you really need to, because all you're doing is masking symptoms by getting a brief adjustment and getting a hit of the endorphins, and it's not healing you. And we really want to heal you. So that's a way to tell if you're chiropractic. And if you see another chiropractor, fabulous. See the other chiropractor. I'm not saying I'm a better chiropractor. I'm just saying that I have seen now in 30 years of doing this that there are those people that the chiropractic adjustment does not take care of the low back pain and does not take care of the neck pain, doesn't take care of the numbness, doesn't take care of the tingling.
Well, and you might hear that your chiropractor tells you that you're not holding your adjustment.
Yeah.
That's a term that they'll tell people. So if you've been told that you're not holding your adjustment, then you probably need to look a little deeper.
You're inflamed, and the chiropractic adjustment's not going to take care of that. And if you go to the medical doctor is just going to give you anti-inflammatories that are going to destroy your gut. It's going to help you in the short term, but in the long term, you're going to pay in arthritis and bone spurs and degenerative discs, in pain. So we want you to live your best life. So I was on chiropractic. I covered the IVs. We covered acupuncture. We covered Reiki. We covered being able to get you to a hormone specialist. If you need mercury taken out of your teeth, we can get you hooked up with that type of a dentist. I guess what I'm trying to say is we have a network now. We've built out a network of people that if we don't do it or can't do it, we can get you to where you need to be. And that's kind of our promise to you is if we can't do it, then we'll get you to where you can, because we don't want you to hurt anymore. So I think that's about it.
So come see us if you're local. We have a wonderful experience waiting for you.
And if you're not local, we can do functional medicine via the internet, and we can do telehealth. I can drop ship you the tests. This lovely lady will get on the phone with you and take you through how to do the testing. And then we will do a reading on the results and get you set up with a plan. So you don't have to suffer anymore. I don't care what anybody tells you. If you are hurting, if you're tired, if you can't lose weight, whatever the case may be, there's hope. You can reverse it. It may take time, but you can reverse it. Have a great night.